Hi, my name is Barbara. I'm a nurse from the pre-admission testing department here at the Institute for Orthopedic Surgery, and I've been asked to talk to you regarding a staph infection called Mrsa. And we all have bacteria on our skin, and of course that's a normal finding. But this particular kind of bacteria, if it were to get into your body through a crack in your skin, can cause a very nasty infection that's very difficult to treat with some of the more common antibiotics. Mrsa stands for methicillin-resistant Staphylococcus aureus, and there's two different ways that you could have a Mrsa infection. The first is if you have an active infection. That's where you have a serious problem. You may have a cut, a sore, a boil. You have an area on your skin that may be red, hot, swollen, pussy. You have an obviously infected area that would hopefully have you seeking medical attention immediately. But far more commonly what we see is that people carry this bacteria on their skin. And if you're a carrier of Mrsa, or if you're colonized with this bacteria, you have no signs, no symptoms. Any one of us could carry the bacteria on our skin, and we wouldn't know unless we were checked for it. And we check you here for a total joint replacement at iOS by doing a nasal swab. We screen all of our patients here at the Institute for Orthopedic Surgery for the bacteria called Mrsa. Even if you're having a carpal tunnel or trigger finger release or a minor local surgery or big joint replacement surgery, you get a verbal or written questionnaire. No matter how you would have answered this questionnaire, because you're having a joint replacement surgery, you will get the nasal swabs. Our goal is to do these nasal swabs no later than 10 to 14 days prior to surgery. And the reason for that is because we have a treatment regimen, a 5-day treatment regimen, if we do get a positive test result. If your test result is positive, you'll be hearing from your physician's medical assistant the morning after your testing is done. If you do not hear from your physician's medical assistant, then you are not a carrier of the bacteria Mrsa. If you are positive, the physician's medical assistant will call into your pharmacy ointments that we have for you to use for your nose and for your rectum, and we have you use special soaps to bathe in for 5 days. You are to use these products only as ordered and only for a 5-day period. We would then bring you back 1 or 2 days prior to your surgery, and we would re-swab your nose. And in most instances, if you use those products properly, we would get a negative test result, which of course is our goal. If you do happen to get a second positive test result, so we're still detecting that bacteria Mrsa on your skin, you would still have your surgery, but you will be put in isolation, meaning the people that take care of you, your family and friends that come to visit you, must wear gowns and gloves, and then you would receive additional oral antibiotics, IV antibiotics, and additional soaps and ointments to use. Next, I'm going to talk to you about how to prevent the spread of the bacteria Mrsa if you find that you're a carrier, but it's common sense guidelines for all of us. Make sure you're washing your hands frequently. If you don't have soap and water available, please use the hand sanitizers. Make sure that you're bathing or showering every day to help cut down on bacteria on your skin. If you go to cough or sneeze, please cover it. Make sure that you're washing your hands afterwards. Make sure that you keep your fingernails short. That's a really good breeding ground for bacteria, especially if you find that you're a carrier of Mrsa. Also, make sure you wear clean clothes, that you have clean bed sheets and towels. Don't share personal care items, toothbrushes, for example, with razors with other people. And if you do have a compromise in your skin, if you have a crack or a break or a scratch, if you have an incision, any open area on your skin, you need to keep it clean and you need to keep it covered up until it's healed over, until your surgeon tells you that you don't need to cover it up anymore, because that's how you can get an active infection, is if that bacteria were to get into an open wound. So finally, take good care of yourself. Please try to eat right, exercise, avoid stress. And if you do have any signs of infection, please contact your healthcare provider. Signs of infection would be heat, swelling, pus. You may be running a fever, redness. Please contact your healthcare provider with any signs of infection. Thank you for watching this video today. If you have any questions at all, please call us at the Institute for Orthopedic Surgery.